Good afternoon. My name is Sergeant Lake Patrick Gu. I am assigned to the 512 Field Hospital in the EMT platoon. My reaction to treating Sergeant Hugo, the working dog, I was a bit surprised. Typically, we have semi-realistic training models, known as diesels, to practice with. So when we heard the call come in that we were getting a real live working dog, it was pretty great. It was good to see the handlers getting in on it, as well as the other medics. It's the live aspect of the dog, of course, definitely changes some things up. Dogs, just like any other human patients, it adds another level of concern. We can't quite speak to them, so we just need to do our best to work with them and the handler to render aid. Treating human patients compared to canine patients, some slight differences. Anatomy for the most part is the same. There are some pieces of equipment such as tourniquets that don't quite work on dogs compared to humans, just because the different shapes of the larger aspects of their legs. Canine leg compared to a human leg is a little more triangular, so we'll have to use different supplies to control bleeding. IV access, we're still able to use the same needles, we're still able to use the same catheters and saline locks, but fur definitely does play a role in this. Your average human patient isn't quite as fuzzy as a military working dog, so making sure you have a good set of charged clippers is definitely important for military working dogs. Overall, yes, the experience was positive. Treating this canine patient, it's really great to see during this hospital exercise that we're able to increase the realism of our training, just to, if push comes to shove, really see what it's like in a deployed environment, treating all kinds of casualties, human or canine alike. Having the handler, I feel, is very important to the safety of all involved in the field hospital and just in the field hospital environment itself. The first step to treating any canine patient is to muzzle it, and in the best interests of all the involved parties, the muzzle is very important. The best person to put on that muzzle is the handler, because they have built the most rapport up with this dog. The dog trusts them, and as long as the dog trusts the handler and the handler trusts us, the dog will in return trust us. Sergeant Hugo, the military working dog, seemed very on edge as he arrived. It's a very stressful situation, being loaded into the helicopter and unloaded, a lot of loud sounds, heavy winds, and being placed on a table with a bunch of strangers surrounding them, putting all kinds of monitors and blood pressure cuffs and things. It's a very stressful situation. Luckily, we had the handler there, and with the handler and also our ER providers and docs, they were able to help calm Hugo down, and Hugo let us train. It was very important for the handler just to get hands on the dog. He was there to hold the dog in place, also just to kind of pet it and let it know that it was okay. And as the handler muzzled the dog and was able to keep it on the table, the provider was also to gain control of the hind legs, just to stop the dog from kicking around so much. After which it realized it was in a safe environment. Sergeant Hugo calmed down.
So today we did some training on medevacing the dog after a simulated blast injury. They simulated a gunshot wound to his back left leg, and some abdominal bleeding. So this is MDD Hugo. He's a mine detection dog. We're out of the 94th Engineer K9 Detachment. He detects and smells for buried landmines, UXOs, and IEDs. So I'm a recent graduate of our schoolhouse. We go through 5 months of school. We start with a fresh dog and a fresh handler. We start imprinting them on TNT and work our way up to buried landmines that we have actual landmines in Fort Leonard Wood. He's 2 years old. I thought it was great. A lot of these medical staff, they don't get to work with canines a lot, so that's always great. I haven't been on a bird with him before, so that was great training, get him desensitized to it, because part of our capabilities is that we can be transported by any means, so helicopter's part of that. I think they were all a little surprised, and they all think he's real cute, so yeah, it seemed good, seemed like a good reaction from all of them. Yes, so Hugo's never been on a helicopter before. This was his first time. He was scared, obviously. It's big, loud, makes a lot of movement. It's all things dogs don't like. So he wasn't a fan of it, but I got him on there. He trusts me, so he got on there. At the end of the day, he's got to get on the medevac bird. Yeah, so we're pretty bonded. I mean, we work every day together, all day together. All we do is train with the dogs. So we get really close, and especially being out here, they sleep in the same tent with us. They get all their meals from us. Everything is from us as handlers. So they're very close with us. They don't get much interaction outside of that, so they're very close to us. I think it's incredibly important. We have these incredible tools, and sometimes bad things happen, and they need to be, like in this scenario, they need to be medevaced, and it's good for our allies to see us how we conduct ourselves, how they could help if something were to happen in real life. Honestly, once we got in the air, he was pretty calm, so that went really well, I thought, and I wasn't expecting that. I was expecting him to be he was stressed out on the bird, but not as much as I thought he would. Obviously, with all the medical stuff, touching his paw pads and stuff, he wasn't a huge fan of that, but that's just learning curve. He's a young dog. It'll come with time and training. When we deploy as a team, so it'll be me and my dog, and then another handler and his dog, and then a vet tech that comes with us for medical support. The vet tech was he was through the whole medevac up until the bird, briefing the medics on everything that is wrong with the dog, every medication that they give in the dog, all the vital signs, the dogs, because they're all different from humans. Yeah, he was a critical part of it.